Well, birds do it, bees do it, even educated fleas do it. Human sexuality throughout life, tonight, on call with the Prairie Doc. Good evening, and welcome to On Call with the Prairie Doc. It's too easy to have giggles and sophomoric humor when human sexuality is discussed, but it does make a significant difference at all stages in our lives. First, let's take a look at this week's Prairie Doc quiz question. True or false? Sexually spread infectious diseases can increase the risk of prostate cancer in men and cervical cancer in women. True or false? We'll announce the answer at the end of the show. Joining us tonight are Dr. Robert Santa-Cruz of Regional Health Medical Clinic, practicing urology in Rapid City, and Dr. Marcia Beshara of Rapid City Medical Center, practicing obstetrics and gynecology. Thank you both for joining us.
Pleasure.
So, a urologist and a gynecologist talking about sexuality. How better can it be? I love this. Tell me, Marcia, a little bit about where you're from and why you got into OBGYN, and then why you've kind of expanded into the world of sexuality.
So I grew up right here in Rapid City, South Dakota, and I went to college for biology and chemistry, and I actually taught biology and chemistry for a little while. Oh. And then I decided to go to medical school, and I went to medical school at the University of Minnesota in Minneapolis, and then I elected to do OBGYN. And I had tried out many other specialties, even urology for a bit, but I really enjoyed taking care of women and knowing that I would take care of women across all of their lifetime. And that's what really drew me to OBGYN. And then I went to Mayo Clinic in Rochester and did my residency. Once I finished residency, then I came back here and I've been at the medical center ever since.
And you delivered babies. Are you delivering babies still?
I'm no longer delivering babies. I did that long enough, and
yes,
now
that's a tough area.
Yes, and now I focus specifically on gynecology, and so I do again women of all ages, and it's very fun now because I'm actually taking care of young ladies that I delivered as babies.
Oh wow!
Yeah, so that makes it very neat.
So the whole cycle of
life.
Yep.
Yep. So I get from the young women all the way to my oldest patient is in her 90s.
Oh,
so
wow.
yeah, delightful.
That's good. And Rob, you're a urologist, originally from where?
I grew up in Miami, Florida.
Oh wow! So we're in a colder climate here.
Yes.
How long? You've been here for how long?
Relatively new. I started May 1st.
And what brought you to South Dakota? It was the weather, I'm sure.
Oh, for sure. Like most good stories, it was a woman. My lovely wife is from Minnesota, and we were living down in South Carolina for several years, and the summers became oppressively hot, and so we were looking for an opportunity to move back to the Midwest, and the opportunity arose here in Rapid City to join Regional, and it was just a great option for me and my family.
Great. And so urology covers mostly, I mean, what do you see mostly as a urologist? Prostate disease as a rule, probably.
A lot of what we do, yes, is prostate, but we're fortunate in urology to really take care of a wide spectrum of diseases, and we take care of also people from age 0 to 99 and both sexes. So I think for most urologists, we find it a very rewarding and challenging profession.
So, and sexuality is part of that. And guys are really reluctant to talk about sexuality. I mean, I would guess.
Women.
Well, women are also reluctant. Mm-hmm. But guys worse than women, I would think.
Maybe.
Yes, it's hard to get some men to open up. But, I try to make it sort of matter of fact and not a big deal. I just put on the table, how's your sex life, or how are you having intercourse? And I'm amazed at the answers I get. You'll have the 90-year-old that says absolutely, and then there's younger men in their 30s and 40s who are having problems. So just opening that door and giving them an environment where they feel safe and can express their concerns is really important. As a urologist, many of the diseases I treat affect and cause side effects to people's sexual life. And so
prostate surgery.
Absolutely. Prostate cancer is the #1 issue we deal with, but also we know now that patients with chronic prostatitis can also have a higher risk of prostate cancer. And unfortunately, all the therapies to treat a prostate, whether it be removing it or radiating it or freezing it, all of them have implications on your sex life, whether it be changes to your ejaculatory function or merely just the inability to maintain an erection.
Right. But that doesn't happen in all of them. I mean, you can do it now better where it doesn't wipe it out, whereas early prostate surgery, I mean, it was gone.
Right. I mean, it was a total write-off in the past. But yeah, so we've developed technologies, especially with robotic surgery, which is one of my fortes. We're able to now do a nerve-sparing dissection during that procedure, and we're able to preserve sexual function in many people that in the past would not have been able to, would have had to make a very difficult choice between cancer treatment and preserving their sex life. And so fortunately, we don't have to put those people, all of them necessarily, in that position today.
Yeah, that's wonderful news, you know.
I have a question for you as an internist. Many patients also have difficulties because of their health issues. So for instance, their diabetes, their hypertension, some of their other heart issues. It makes it difficult for men and women, or let's just say back problems, hip problems. Everybody's had a hip replaced after a certain age.
Right.
So as an internist, I'm sure you saw many of those same situations and had to talk with people, men and women, about how to deal with their own health, but also their partner's health.
I think the biggest problem with caring for people as they're going through their aging process is that medications affect sexual function way more than I thought early on. Mm-hmm. And they'll come back and they're reluctant to say that blood pressure medicine or that antidepressant or that, you know, the drugs that we use for day in and day out internal medicine, you know, affects sexual function sometimes. That's one thing. If it hurts to move, you know, sexuality brings a fair amount of emotion. There's a emotion part to it. So back pain and hip trouble can affect that. And then the pain medicines, that's another side effect. So that was a good question. I think you're the first person who's ever asked me a question on this show. Thank you for that, Marcia. So there is a lot going on there. Now I'm going to ask in women and in men, I'll ask you separately, how much do you think the sexual dysfunction is a result of an emotional issue or a physical issue?
So in women, and I tell my patients this all the time, for women, they use sex to feel very close to their partner. In general, I tell them men use sex for everything. If they feel good, if they feel bad, if they are in love, if they've had a good day, if they've had a bad day. And women in general, it seems to me, want to draw themselves closer to their partners. And so they don't use it, and I use that word loosely, use, because they're really not using sex. They desire it. They're driven to it.
Yes.
I mean, first they're driven to it to reproduce. But
Right.
secondly, once that's over and done with, then women use it to maintain that closeness in a relationship. And in men, they do too, but it's maybe not quite at the forefront of their minds. And so I think the important thing for women over their lifetime is to continue to be functioning as they would like to. And for them, that isn't always the act of sex, but many times that's where they feel the most satisfied, because they too want to continue to have sex, no matter if they're in a wheelchair, no matter if they have breast cancer, whatever their situation is, they want to continue to have sex. And so my job is to help them first find a way to have it satisfyingly, and second, help them work through their medical issues. And as you mentioned about the antidepressants, sometimes we put women who can't go on hormones on antidepressants to help with hot flashes. Well, then their libido falls. Yeah. And so we end up treating one thing with another, but the ultimate goal for me is to help them find what's ever satisfying for them and what works for them. And we have lots of options now. But like you said, the important thing is opening up that door and getting them to communicate, and having doctors who will say, well, and you know, on every exam, you're checking the male parts, I'm checking the female parts, so I just say, just like you, How's sex? Are you having sex? Is it painful? Is it comfortable? Are you finding ways around that? Are there alternatives for you?
So you'd say it's a 50-50?
Yeah.
I'm sorry, I'm done.
Back to the question, yes.
Yeah.
I would say 50-50.
Okay, all right. Rob, what about guys? How much is an emotional and how much is a physical cause?
Well, I think as men, we like to think that women are the more complicated sex, but certainly men are complicated as well. And I think to answer that question, it really depends on the age bracket. If you're talking to younger men in their 20s and 30s, which I've had a number of men in that age range come to me over the years complaining of sexual problems. In that case, their bodies haven't had enough time to accumulate damage from all the diseases that typically cause sexual dysfunction, like diabetes, high blood pressure, cardiac disease, etc. I think those men are generally having emotional issues that are putting a lot of stress, and we know from a physiologic standpoint that stress, the hormone that manages stress in our body, is epinephrine, and epinephrine is part of your sympathetic nerve system, and that destroys your erections. So just having circulating epinephrine in your body will make it impossible for you to maintain a good quality erection. So for men who have a stressful encounter and then wonder if they can perform in the future, that stress almost becomes self-fulfilling.
Oh, it does. I mean, the fear that I can't perform, and then they can't perform.
Correct, absolutely, 100%. So for those men, it's really about giving them the reassurance that their physiology is still good, that they can have an erection. They just have to learn to calm their minds and to manage that stress. Sometimes we'll use drugs like Viagra to help augment, to help get them past that spot. But eventually, with enough, having a supportive partner is also very key. Being able to talk to them about it, saying, I'm working through this particular issue, and I'd really appreciate your support. And I think that helps men in that age range get over their problem.
Well, this is a very good conversation. I'm enjoying this because we are talking about the emotional side of it. And it made me think about the fact that through my years of experience, I've often thought that the guy is the non-emotional, stoic, tough, and the woman is the one whose feelings are on their sleeve. But I know different. Men really are emotional, and I think equally as emotional, they just have more cover-up because they were taught that guys don't talk about these things.
You don't want to portray weakness in any way. So.
In any form.
Yeah.
And that's a wrong thing. That's a bad thing.
Yes.
And historically, I think in women, the problem for them emotionally is they've been told to suppress all feelings of sexuality. And so
it's a bad thing.
Yes,
historically.
Historically.
Bad.
And so that's one of the benefits now is that we're talking about it more. And historically, we're out there discussing not just men and women, but the fact that everybody has emotions, everybody has feelings, and everybody needs to express them. They don't need to suppress either their feelings of insecurity or their feelings of, I'm a little nervous and afraid. I mean, or I am a sexual being and I need to address that.
And we can talk more about that. I was thinking about anger being really a man's way of talking about saying he's depressed. But we'll get back to it in just a minute. Why is it important to honestly deal with sex in a relationship, and what are the roadblocks to a healthy sexual life?
Sex is a basic human need, and so healthy individuals find it gratifying, and I think especially in a committed relationship. Depending on how you grew up, it's sort of a topic that wasn't maybe shared or discussed in a family, and I think there's still some taboo or some guilt or shame attached with sexuality, as if it's something that's wrong instead of a normal human behavior. I think one of the biggest obstacles is probably time, quality time together, and so sometimes sex gets pushed off to after 11 o'clock and people are tired, and it's really not the best time of their day, and so it kind of limits the quality of the relationship and quality of the sexual activity. to teach women to communicate with their husbands, because there might be pain involved, and there can be ways through different positions to reduce that and to make things better quality and more comfortable. Spending quality time together, talking about things, and then maybe discussing our interest and preferences in sexuality. I think it's something that no matter how long a couple has been together, is still something worthy of talking about. And I think that you might be surprised. I think people take for granted, I've been with you for so long, but things can get routine, and taking another look at it is probably a good idea for most couples. It's important to be playful and have fun with sexuality. I think that's something that people may forget, and that it requires some honesty. It may require forgiveness. It requires quality commitment toward one another, and it might require knowledge. So there might be some reading that we would want them to do to learn things. You're never too old to learn new ways to address sexuality in your life, because it can be a rewarding activity throughout the lifespan. Your sexuality doesn't stop at age 60 or 70. It can move on well into your 80s even though I think that's something that people are less willing to talk about. It's very true and very possible.
Well, of course, openness is an important thing, right? Being able to communicate. But sometimes there might be anger that is built up, maybe because there's been a betrayal, or maybe because you're tired and depressed, or whatever it might be with each other. And that destroys some of that communication. What can we do to improve communication between partners?
As a practitioner, as a doctor, what I do enjoy and appreciate is sometimes when things are falling apart in a patient's relationship, she will actually bring her partner in. And not that I have any special training or counseling background, but sometimes, like you said, the openness piece of it, just being a third party that's open to listening to what the two of them have to say, and just facilitating their conversation, I think is a way to open the door.
I have seen that exact thing where two people who love each other, get along very well, but then there's a bump in the road, and they can't say it, that this is what makes me mad about what you're doing, either one of them. But a third party in the room who's saying, so what's wrong? One will speak to me about what is frustrating, and the other will say, but this is what's frustrating me, and that they finally figure it out. This is what's going on, but they couldn't say it between the two of them. That's been a revelation to me in my practice.
Or they may fear the reaction of the other partner, and having a third party in the room just helps diffuse that a little bit. So I think that's important as well.
Yeah. What do you do in mostly you're probably talking to the man, to help him open up to his spouse or partner?
Well, we know that intimacy is the glue that keeps the relationship healthy, and so much of our self-esteem is wrapped up in how we interact with our partners, and so I think it's just vitally important to our health. As we know from other disciplines, our mental health is so intertwined with our physical health that addressing these issues is paramount. And to me, I like having the partners come whenever oftentimes the first appointment, the man or the patient will be there alone. But if I sense that their intimacy or their sexual performance is the main issue, or one of the issues that brings them to me, I will encourage them to bring their partners at the next visit and to have a dialogue about what the issues are. And I think it's been very well received. I think most urologists we're sort of very busy guys or gals, and we're just trying to get through our clinics. But I think taking that extra minute goes a long way and opens the door to communication, which, as we know, is so vitally important here.
Some movies will show a successful relationship built on the man being the dominant person which I think is wrong. And the man being the forceful person, and it even suggests that physical force keeps the man on top and it improves the relationship. I think that's fairy tale. And it goes even so far as to abuse. Any comments about abuse that the two of you would like to make?
I think the most important thing you said is control, because that's what it's about, power and control that leads to abuse.
Yes.
And I think the best relationships that I've ever witnessed, there's equal power. And that's the problem with abuse, is because it comes with a desire for complete control and complete power. And it's hard to overcome, but it certainly is something that I talk to patients about every day, because they are many times in situations where they don't have control. And so my job is to help them find control in some portion of their life.
One definition, well, American psychologists and psychiatrists have agreed on this, that the definition of abuse is control by way of physical abuse, by abuse of financial abuse, by emotional abuse, which I think is the tool women sometimes do more on the man. I mean, I think in that sense, physical abuse, men do more. Emotional abuse, it's equal. And but control is the issue, isn't it? Mm-hmm. It's control by whatever means, which is freedom. Allowing a person freedom to choose on their own is the most beautiful.
It's complete bliss.
It's when two people say, okay, I'm hearing what you're saying. Rob.
Well, I think it circles back to failure of communication. I mean, if you look at children, when they get angry or upset, they don't have the verbal skills to work through that problem. So they often will sort of fall back to striking out or some kind of physical response. And I think for a lot of men who have the inability to really communicate their feelings, being physical is a sort of an easier approach to it, instead of working through the underlying problems, whether it be some frustration or insecurity they may have. So I think opening that dialogue is going to certainly improve relationships, I think, that are suffering from abusive situations, and so I think by furthering that goal, we can really make huge inroads into keeping domestic violence to a minimum. I mean, certainly there's a very complicated set of things at work there, but I think a large part of it comes down to failure to communicate and using physical control as a means of control rather than persuading someone to agree.
Or to talking it out.
Right.
And respecting the other person's freedom to choose. I think that's it. Mm-hmm. What about what is it that you think is the glue that happens between two people? I mean, I think that Mother Nature tricked us into falling in love. This is a magical time that is just this wonderful thing. You're with the most one, but that goes away over time and allows two people to build a relationship of love and caring. That's a changing thing. But how would you define that glue? The glue that brings us together. I said it quickly. I want you to say it in your ways. Start with you.
If you just look at, I'll just say, all of nature, why is the reason we're here? All of us, animals, plants, humans. It's to reproduce.
Right. That's.
And luckily for humans, we enjoy that portion that leads to reproduction.
Yes.
You know, I think in the animal kingdom you can see it so quick that there's really not that much enjoyment going on.
No, it's
but as
boom.
humans, we would like to enjoy it.
It's wham bam, thank you, ma'am.
Yes, and we do enjoy it.
And it isn't that way with us most of the time.
And so the important things, just physiologically, you know, the endorphins that are released, the oxytocin that's released, it gets your heart rate going, it gets your blood pressure up a little bit, and all of those things are just like exercise. So it's great exercise.
It is great exercise.
Yeah, and so
We should do it more, don't you?
yes. So that's what I think that magic is. It's the spark of not just reproduction, but once reproduction is over with, then it's the spark of, this really does feel good.
This is a really good thing. And it builds a relationship. I mean,
Yes,
it
it
is the
does.
glue that keeps a relationship. As you said, the glue that brings a relationship together. It's important for it. What else about the magical part of that changing portion, the growing, developing part of sexuality?
Well, I think so much of it is, it comes down to the individual partners feeling comfortable in their own skin and understanding what they can give. I mean, I think a lot of times people enter intimacy or sexual relationships very early in their relationship before they've really had time to mature or to appreciate the other partner, and so they take it for granted, that gift that we have. And you know, I think that's why I think a lot of marriages fail, is because they're not given enough time to really you know, be comfortable in their own life and their own body and mind before they enter a, you know, committed relationship to another person. And you know, I'd like to see us as a society to think about that more before we enter committed relationships, and to value them. I think a lot of times now we sort of just have a disposable mentality, and we'll go ahead and get divorced and move on, and all those things bring damage over time that is irreparable. And so you know, my children, I want to have that conversation with them one day, and to take it very seriously, and to understand that in order to be good to someone else, you have to really be good to yourself first, and to appreciate what that other person's bringing you.
You got to fill your own barrel before you can start spilling over and filling other people's barrels.
Mm-hmm.
I've heard that one before.
Yeah.
Well, these are all emotional things that we're talking about, and I think there's a spiritual part of it, but I can't explain it. I don't think anybody knows that spiritual part, that emotional love that you can have, but it is certainly a real part of it. But we're going to want to move on into the physical part of it. What are the things that make sex work? Some people have problems making it work. What are tricks of the trade that we can do to bring a person to fruition, to orgasm? I mean, you know, that's part of it. And so we want to go there. I just wonder have we completely finished the things you want to say about this? How about sexual? I had a story I need to share. A mid-80s lady who was a dear friend of my mother's, and who my mom was gone at the time, and she was dying. And she said, Rick, and I wasn't her doctor, but I was making rounds at the hospital. She called me in and she said, Rick, you got it. And I had this young college shadowing person thinking about going into medicine with me, you know, kind of a timid girl. And she said, you got to hear this story that I met this man at the dances that we go to on Tuesday nights. And I finally said, you know, come on over for dinner. I'll cook you dinner. So she cooked an elaborate dinner, and they had a nice day and a glass of wine. And then she said, Rick, and then we took our clothes off and went into the bedroom. And of course, he couldn't function. He was 90, but we just were with each other. It was the most beautiful thing. It was just wonderful. And I looked over the girl's mouth open. And then she said, I asked him to come the next Sunday. So we came over the next Sunday, and we did it again. And the third Sunday was wonderful. And then he died. Wasn't that a wonderful story, Rick?
You should have seen me the week between.
Yeah.
Might have helped him.
He might have helped him. I love that story. She was such a wonderful intellectual college professor, and it was just a beautiful story.
Mm-hmm.
We'll do this, and then we're going to come back. What can we do to help problems like when people have vaginal dryness or when erectile function is sagging? So, when and why should someone seek counseling about their sexual concerns?
I think one thing that's important as a therapist is to offer a non-judgmental, welcoming presence to someone, not putting expectations on them, but learning from them who they are and offering them a safe place to explore that. I think that's the value of therapy for this situation. Get a medical workup to start with, just to make sure that there's nothing medically going on that's hindering sexuality. And then another consideration is aging. So there are things that can be done to help someone who maybe has difficulty with their sexuality as time has progressed. And so there's some medical things that we can do. And then through a counseling relationship, a couple can talk about what barriers they have to sexuality and work through them together in a satisfying way. From my end, it would be discussions. Sometimes we do a behavior treatment plan where we start with non-sexual touching and spending more quality time together, massage and things like that, and then work into more sexual related behaviors, hopefully moving into increased comfort as you move into full sexual activity. Encouragement. Don't stop trying. There's things that maybe could improve, and people are surprised at that. If they can get past their anxiety, sometimes there's some real rewards in taking a look at issues that we have in our lives. Really want to encourage people to move past the stigma about receiving mental health care, and to say that mental health care is part of whole health care. And so we look at the medical, we look at the psychological, working together. I think that we can get very good outcomes, and people can improve the quality of life and enjoy sexuality and just life in general.
That's such good information, and I think the idea of having an emotional relationship between people who respect each other, then there's a great chance of it working. So it can be such a wonderful thing. But there is a problem with people who are not loyal to their partner. And we also know that 60% of marriages fail. The divorce, and they find another partner. Can we address that in any way? I mean, why is it that that kind of activity is bad? How would we say that, Rob? You know, can it be a bad thing? Is it a betrayal issue? What about that?
Well, I'll just tell you, the most of the reason when patients come to realize that there's a problem in their relationship in my clinic is when they have a positive PAP and they find out they have HPV, and then they think,
oh,
and they're 50 years old.
Yes.
And they think,
someone was
so
disloyal.
then, yeah. And I always try not to place blame, but you know, it came from somewhere. It is an STD. You can't get it in the pool or from a toilet.
Yeah.
But
That's a problem.
I'm very careful. And so I think in my clinic, that's the biggest betrayal is, I think sometimes they're okay if they don't get something, but as soon as they get something, they're not happy.
Right. Rob?
Yeah, I mean, I would agree. I think being disloyal brings so many other problems with it. You know, the dishonesty that has to be a part of that. You know, not being truthful with your partner, it just destroys trust. And once that's gone, really don't have that relationship anymore.
That
It's-
glue
Right.
gets pretty loose.
The
Right.
magic is
The
not
magic
there.
goes away.
Right.
Well, and I don't think that divorce is a bad thing when people have lost that glue. I've seen wonderful people realize that relationship is not, and sometimes it's because that isn't the person that I remember marrying. I've moved on in this direction. The other one did a different direction. No fault. I think that no fault divorce is a better deal than anything. But it is a problem. It is, and we needed to talk about it. Let's talk about other things. I mean, sometimes we should talk about STDs. What are the infections that can be spread? I think maybe the church, which has always said loyalty is the most important thing, no divorce is good, really traditionally did that because there is infections that can spread. And the original reason was certainly very appropriate. But what STDs do we see?
So number one in my clinic is HPV, human papillomavirus, and it causes cervical cancer ultimately. It's very slow growing. We now have a vaccine for it. We vaccinate our young men and women. In fact, they're boys and girls when they're vaccinated. They now can start at age 9 to 11.
And you want that because you can catch them before they get any sexual activity.
Yes, and that's the important thing. So it not only protects against the HPV vaccine, which causes cervical cancer, it also protects against condyloma, so genital warts on the outside. And for many
It can
women,
be very painful.
Right, very painful, and they're embarrassed by it. They don't like having condyloma. So HPV is number one, chlamydia is number two. Then probably I would say herpes, HSV. Sadly for herpes, they can have outbreaks the rest of their lives.
Right. It's like cold sores.
Right.
And
Only
on the
in
lips,
the-
but
right,
it's in
right.
the other areas.
And then the last one that's on the rise right now in the OBGYN community is, and of course in urology, but you maybe don't see it because we test everybody who's pregnant, is syphilis. So those are the ones that we see the most of.
Right, and syphilis is on the rise.
On the rise.
Any comments about that, Rob?
Well, we see the same diseases. I mean, they are sexually transmitted.
Yes.
So, the same. Obviously, the organs are different. Men have their warts generally on the penile shaft or on the near the head of the penis, or it can be on the scrotum. But these are all very embarrassing, disfiguring, as we have to treat them either by removing them with a knife or using cryotherapy or freezing. But I think it's just kind of belays the point that it's so important to practice safe sex and to have one partner, or if you're going to have more than one partner, be safe. Wear a condom or ask the questions. And I think it's often very hard to discuss STDs or history of STDs, especially one like herpes, which is with you for life. It's very, very difficult for somebody who has that infection to bring it up to a new partner, and it can be very, very stressful, traumatic, and lead to a temptation to be dishonest almost from the beginning, which is certainly going to erode that relationship's
You have
glue.
if you have to say to your patient, there is no guilting this. Do not carry any anger towards your partner. Leave that alone. I mean, because it might have been one relationship years before they even knew you. So you just forgive that. That's not something to be destroying a relationship.
Well, and as you know with herpes, the difficult thing is they can have an exposure and not have the outbreak for sometimes years.
Right.
So that's why often we see it too, because the first time they have an outbreak, even though they've been exposed in the past, they're having an outbreak during pregnancy when their immune system isn't working. Or
And HPV is the
right, same exact thing. So we see these things in pregnancy, and then they're just devastated because they, like you said, they were exposed during a previous relationship even. So we try not to place blame at all.
No blame.
Right, you just go forward and, like you said, be honest.
Yeah. So let's talk about the issues of improving sexual function in men. What drugs do we have, and how have you prescribed them?
Well, if you think about what is required in order to have an erection, you have to have a good mind. You have to have nerves that connect your mind to your genitals to have arousal and stimulation. And all that requires good blood flow to fill the penis. So you need a nervous system that's working well, you need an arterial system that's working well. And unfortunately, those things tend to go bad as we age, right?
Or if you have diabetes in particular.
Right, if you're diabetic, we know that causes nerve damage and small vessel disease. So we can employ, first-line treatment is oral medication therapy, like Viagra or Cialis. There are others, those are the main two. They've become generic now, so there are a lot, at least Viagra has. Cialis is due to be generic soon, making them much more affordable for our average patient. In the past, these were $30 a pill, but now you can get them for under $1. So it makes the access much better for everyone. If those were to fail, we have more aggressive second-line treatment, such as penile injection therapy or even a vacuum erection device. These are very low-tech devices that can bring blood to the penis, and they use a penile band, or basically like a rubber band at the base of the penis
to hold
keep the blood there, right? Yeah. Very low tech. It does require a little bit of manual dexterity, but so for some of our older patients that have problems with arthritis or have Parkinson's or other ailments, they may have trouble. And the last is a penile implant, which is a surgical procedure which we do offer at regional, and many urologists do. That is requires inserting a device inside the penis. Everything's below the skin, so nobody could see from the outside that you have anything there. But it does a wonderful job of reproducing your natural erections and allowing a man to perform at will. The problem with some of the other medications is there's a lag between when you take the medication and when there may be efficacy, and so that lag can make
the timing of it all.
Timing a bit awkward, right?
So the guy's got to say, okay, in about an hour, we should be having love, but so you should present that to your partner before you.
Right, and that goes back to communication, but also just little tips I can give my patients. One is to not have a very full stomach, so don't eat a huge prime rib and then pop a Viagra.
Exactly.
It's going to take a lot longer to work. And also, alcohol is also another detractor, so 1 or 2 glasses of wine, okay. 4 to 6, no good. So those kinds of little tips, you'd be surprised how people just don't think about it, and it's a little bit of retraining. Even those medications have been around quite a while.
But the over-the-counter, mail order, advertisements on yohimbine and whatever herbal supplement.
Be like Bob.
They are basically bull crap, right?
Well, none of them have been really truly studied, so a lot of them are puffery, sort of the...
Puffery,
yes,
that's a good way.
Yes.
Marcia, what about the sexual enhancement things that you can do for a woman who may be aging or is having problems?
So the biggest problem, I mean, we have the same issues in the woman's world, is the lubrication. So yours is getting the erection, ours is being lubricated. After you lose your estrogen going through menopause, you still have some around, but it's very, very low. The vagina is very thin, and it can tear easily, and it starts shrinking. So the collagen and elastin are gone. So a couple things. For some women, they think, I don't really want a medication, so we start with lubricants and vaginal moisturizers. Some of the lubricants are silicone-based, and they're much slipperier than water-based lubricants. Some women like to use coconut oil, but and it works well for them, but like this, it hasn't been studied.
Your preference, if you were going to give one?
A silicone-based lubricant.
And where would you find that?
Well, you can get them at the any of the pharmacies. You can get them at Dick and Jane's.
What is the name?
Oh, Uberlube is my favorite.
Uber.
Uberlube. Yeah, Uber.
That's
Uberlube.
Kind of okay.
And they recommend you can use it in your hair, or if you're an athlete and your thighs rub together, you can use it between your thighs. I mean,
as you're doing your marathon.
Yes.
Ooh, yes.
So that's something women can do over the counter. Things that we can do for them to replace their estrogen, if they're not having hot flashes or night sweats, they're only dealing with vaginal dryness. There are many preparations that are estrogen products that can go in the vagina.
So you can use estrogen in the vagina and not put yourself at risk of breast cancer.
That's exactly right. So there's a pill, there's a cream, and there's a ring, a small ring that releases estrogen slowly into the vagina.
And your favorite brand?
Well, the most convenient one, which everyone's about convenience, is the pill. It's called Vagifem, and there is also a generic called Uvafem. And sadly, of course, most of the Medicare coverage is not there for it.
This is where our fields overlap quite a bit. I mean, also, what wraps into this is sort of a lot of women have urinary incontinence, involuntary loss of urine, which impacts their desire to have intercourse. I mean, they don't want to have an accident on their partner, and also a lot of women have had hysterectomies in the past and wind up having prolapse, which is a dropping, or basically like a female version of a hernia through the vagina where the bladder drops. And these are all issues that as a urologist I see that women don't want to talk about and dramatically impact their desire to have intercourse.
And that's what we correct as gynecologists, is the prolapse and the lack of estrogen. And even the estrogen, as you know, helps with the leakage of urine often, especially the urgency if they have an urge. And then there are a couple other things, because of course we have patients who can't use estrogen at all, even in the vagina. So women who've had breast cancer or their family has a history of breast cancer. Then we can use, there's a laser, the Mona Lisa Touch laser, which is a CO2 laser that is just like lasering the face. It increases the blood flow, increases the lubrication.
So get some help if you have that.
That's exactly right.
An expert like you on this issue. After this short break, please stay tuned for the important takeaway messages from our guests, as well as the answer to tonight's Prairie Doc quiz question.
You are what you eat. Use it or lose it. Be careful out there. Words of wisdom for a healthy life. Nutrition, exercise, and safety. Next time on Call with the Prairie Doc.
Hello to all. I am Dr. Tom Luzier, a practicing allergist in Aberdeen, South Dakota. Born in Kansas, I embraced the diversity of South Dakota. This diversity comes with a price: limited healthcare resources and information. The Healing Words Foundation, through Prairie Doc, provides an open, online, interactive, public broadcasting format for reliable health information. As a member of the Healing Words Foundation Board, I am asking you please to join me in support of this work, which is funded entirely by donations from you. Please consider making a personal or corporate gift to Healing Words Foundation, a 501c3. Go to prairiedoc.org and click on the donate button and make a valuable contribution. Thank you.
Marcia, what are the most important things that you want people to take home today?
You need to talk to your provider and make sure you ask all the questions you need to about safe sex, about comfortable sex, about satisfying sex, because we have things for all of that. And we can help women achieve whatever their goal is in their sexual life, whether it's the emotional piece or the physical piece, so that it's comfortable and satisfying.
All right. And Rob, take-home message.
Well, I think that my take-home message is that erections, the quality of your erections is a sign of your health. So if you're 45 and you're suffering a decline in erection function, it's because you need to take a hard look in the mirror and see what you're doing in terms of your fitness level and how you're taking care of yourself.
Physical activity makes everything work better, right?
100%.
100%. Mm-hmm. A person who's active and running, that's a great thing. And now for the answer to tonight's Prairie Doc quiz question. True or false? Sexually spread infectious diseases can increase the risk of prostate cancer in men and cervical cancer in women. And the answer is
Yes.
true. As noted in the 2013 journal article, chronic infectious prostatitis increases the risk of prostate cancer. And human papillomavirus, which we have a vaccine for, can cause cervical cancer or increase the risk of cervical cancer in women. We'll be right back after this.
Extra, extra, read the Prairie Doc Perspectives weekly column in your local newspaper. More than 100 newspapers in the region print the newspaper column written by Dr. Rick Holm, covering a variety of medical and health-related topics. Ask your local paper if they carry the Prairie Doc Perspectives.
I believe that honesty is almost always the best policy. However, there are some topics people don't want to talk about. The whys, hows, dangers, and wonders about sexuality is a topic that is still covered up. But these issues were much more hidden years ago. Growing up in the 50s and 60s in a small prairie town, I was immersed in conservative values. Cover-up was the operating agreement for our farming community at that time. To discuss in mixed company methods to satisfy a partner sexually, or to openly talk about lesbian, gay, bisexual, transgender, queer, LGBTQ issues would have been disturbing there at that time. This is not to say that kids didn't oogle in private at issues of Playboy or pregnancy didn't happen, but the cover-up and almost denial of human sexuality was as much of the culture as Sunday school at the Lutheran Church. One can say that our civilization is more open now, and I believe this honesty is helpful in many ways. For example, in recent years, LGBTQ has been making their way out of the closet. With more openness, studies have been done and have shown that sexual orientation has nothing to do with harming children, being a poor parent, or even the abuse of each other. Unethical behavior and abuse come from every corner of our society, straight, gay, and everywhere in between. On the other hand, cover-up can demonize good people and even serve to protect those who abuse others. Sexual function is necessary for our species to survive, but it can be much more than that. Treating each other with kindness brings mutual respect. Treating each other with honesty brings trust. Treating each other with reverence for the other person's right to choose brings the liberty to truly love in return. That said, sexual relationships can be complicated. Sometimes hurting and hurtful activity can be unintended or result from not being observant or considerate of the other person's feelings. The other side of it happens when one party fails to communicate his or her hurt feelings. This kind of cover-up can also be very harmful. Certainly, learning to change in order to accommodate our partners, along with large doses of forgiveness, can help make relationships work. Bottom line, the closeness and joy of sexuality in our society and between individuals is greatly enhanced when we treat each other ethically, savor the respect, liberty, and trust that follows, and throw off the cover-up so we can all learn to get better. A big thank you to our guests, Marcia and Robert, for volunteering to come and join us in the Rapid City studio of South Dakota Public Broadcasting. And thank you also to SDPB for sharing their beautiful West River offices and the great staff here at the studio who helped us produce our program tonight. If you'd like more information about this program or to see more episodes, please like and follow us on Facebook or visit us at prairiedoc.org. Well, that does it for tonight. From all of us here at On Call with the Prairie Doc, until next time, stay healthy out there, people.
Major funding for On Call with the Prairie Doc has been provided by
Avera is a proud sponsor of On Call with the Prairie Doc on South Dakota Public Broadcasting. Larson Manufacturing is proud to support On Call with the Prairie Doc as it continues to open doors for important medical information.
and by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota, and with the ongoing support of these individuals and institutions. Brookings Health System, Ophthalmology Limited, Avera Heart Hospital, Dakota Allergy and Asthma, Fishback Financial Corporation, Vance Thompson Vision, Urology Specialists, Brown Clinic, American Academy of Family Physicians Foundation and South Dakota Academy of Family Physicians, Black Hills Medical Society, Aberdeen District Medical Society, Brookings Madison Flandreau District Medical Society, Sioux Falls District Medical Society, Dakota Bank, Orthopedic Institute, Physicians Care Sanford Clinic Community Service Committee, Aberdeen Asthma and Allergy, and Swiftel Communications.